this is Dr. Pavanka. I want to talk to you a little bit about Chill Protocol. So here at Village Vet, we use a protocol called Chill Protocol for a pre-visit protocol. Now, a lot of people get used to using either ACE or Trazodone. We've kind of moved away from ACE-Promazine just because we found that it keeps them from moving, but their brain still has that anxiety. I always think of it as like a horror movie or a nightmare where you can't move, you're trying to run away, you can't move, and you're just still sitting there. So a lot of people don't do just straight ACE-Promazine anymore, but it is something that some people are more familiar with just because that used to be what we used. Trazodone is a good option, but sometimes it's just not enough. So at Village Vet, we do use what's called Chill Protocol, which is gabapentin, which is a pain medication that was originally made for anticonvulsants for seizures. For human medication, they found that it seems to help with pain and it seems to calm because it has a mild sedation effect. So we'll use that the night before. It's relatively safe. Sometimes it makes them a little bit sleepy. And then typically with the night before, they don't have time to really get worked up and mistrust the fact that you're going somewhere with them. And then we go ahead and we follow that up next day with melatonin, which is kind of more of a hormonal thing that we use in people a lot for sleeping. And then we use ACE-Promazine about 30 minutes before the appointment. That way we have the ACE on board, but we also have two different calming medications. So we're already accounting for the anxiety in the head and we're just adding that extra, okay, we're gonna really make sure that we have a good time and we're not going to act out and cause any bad experiences. Because the last thing we want is to cause a bad experience and solidify that thought in your pet's mind that, you know what, I don't wanna go to that place anymore. That is an awful place to go to. And a lot of times it's hard because we do negatively reinforce them when they come in. Because if you think about it, they're coming in for the physical exam, which is a very invasive way to pet a dog or cat. And most of them definitely don't like it when we touch mouth, eyes, ears, feet. Those are pretty sensitive areas that we do need to touch during our physical exams. I actually have a lot of dogs that are afraid of the stethoscope too. It just seems like a really scary thing to them. Sometimes I'll play the target game where they have to touch it. And usually I'll even put like cheese on my stethoscope and have them lick the cheese off so they get used to it not being scary. But sometimes that is a very scary thing to them. But we do that in addition to giving vaccines, giving other injections like Cytopoint or pain medications. So if you think about it from the dog or the cat's perspective, once a year, their humans take them to a scary place with scary smells, scary sounds, and then some crazy people touch them very inappropriately and stab them multiple times with needles. And then they go home and feel kind of crummy because we all kind of feel crummy after vaccines. It causes that immune response that gets them to take that vaccine and categorize it under memory that they need to think of next time when they do see that, which hopefully they won't, but it's a nice little insurance policy. But with that, usually we have a little bit of a mild fever. We just don't feel quite right, kind of like when we feel when we get vaccines. So that's kind of their perspective and kind of what I like to think about and trying to think about how to make their visit better. So a lot of times we do need to think about if we can help in any way with their experience as far as trying to make sure that we have lower traffic times when they come in so it's a more calming experience, and trying to make sure that we do everything the best we can as far as making sure they're calm, they're not feeling rushed or feeling attacked. Sometimes we do need to push certain things for their safety, but ideally, if it's not an absolutely necessary thing, we do try to reschedule and have you come back on Chill Protocol. Now, I will also put in a quick blurb that our animals are very intuitive and they do definitely really feed off of us as humans. I had one of my own, I probably talked about him in other videos, but he was my cat that I had in vet school. And I didn't think I was overly stressed by any of my exams because we had them weekly. And I thought that I was managing really well. He didn't really seem to have any stressors in his life. He lived in an apartment. He got out. He loved going hiking. We went hiking up the Cumberland Gap Mountains a lot. And it was weird because every time I had a big exam that was like 5 tests per one day or something crazy like that, he would have issues, and I would be trying to figure out why he was showing me all these signs of stress, because he lived a blessed life in my mind. He didn't have any stressors whatsoever, but I was definitely stressing him out, even though I didn't realize I was stressed. So do keep in mind too that if you're stressed, they're gonna feel it and they're gonna wonder why that mean lady is making their people stress. So do keep that in mind too. Kind of think about your different things as far as what we can do to make their visit better. And do let us know, because as a team, we want to make sure that your pet's health care and their wellness is as good as it can be. So we'll give you the advice based on what we see from the medical standpoint. Your trainer should give you advice on what they need for the behavioral and like kind of well-adjusted standpoint. And then you at home have the most important part, because you see them more than we do, and you can give us more information on what we can do as far as supporting you through the medical role. Do let me know if you have any questions or if there's anything I can help with. But I would say that if you are interested in this, you should talk to your established vet.